Dr. Gupta, thank you so much. It's such an important time to get answers that, so many questions out there. First, let's talk about the fact that New York State now has its first confirmed case. What does that mean for Onondaga County?
So, thank you for having me, and I think, as you mentioned, it's a very important topic for all the New Yorkers in Onondaga County, especially which I represent, is to provide the right information. Having a coronavirus case in New York State raises the alert to all of us that it could be in our backyard, and we should do everything to prepare ourselves to make sure that we are ready to protect our not only ourselves but our friends and family and our workforce.
Right, and you are doing that. And Governor Cuomo also doesn't want people to be surprised when more confirmed cases happen in New York State.
Right.
How likely, how soon do you think that could happen in central New York?
It's hard to predict because these things, as every day the data is coming, we are continue to have conversation with our healthcare providers, with our New York State Department of Health partners, along with the federal partners, and getting all the information. So as a local health department, we are at the forefront of making sure that we are at the top of the surveillance, in which we communicate with our health systems, we communicate with our emergency management system, and also try to have the community engaged to make sure that message is out and to how to protect yourself. I think that is the key message at this point. I would like to.
Anything differently now? Now, the fact that there is a confirmed case in New York State.
At this point, we won't do anything different. At this point, we have been talking about this for last several weeks since we have the first case in the United States, that we as a community should be prepared. As a local health department, all the health departments are at the forefront of it. If you think of when there was H1N1 in 2009, or any time there is a public health emergency comes, this is what we do. We continue to stay prepared and continue to work with the partners throughout to remind them that it can happen in our community. So what can we do to prepare ourselves, to protect ourselves?
Let's talk about the symptoms. And so many people are confused because we've heard the symptoms are so similar to the flu.
Right.
So how do you know if you wake up in the morning and you have these flu-like symptoms that it's a case of do I call my regular physician, or should I pick up the phone and notify you?
Right. So at this point, we are following the guidelines which are coming from the CDC and New York State Department of Health, in which they are very clarity in terms of it's a travel-related history, which is kind of going to be changing. So we are looking for more updated guidance. If you have symptoms like a fever, cough, shortness of breath, body ache, first thing, this is still a flu season. So make sure you talk to your healthcare provider and get them to test you for the flu or other respiratory viruses, because if we have a cause for the fever, it means we identify the cause, because the fever is so common things in so many other viral illnesses, and this is a flu season. At this point, we have more cases of flu in our community than anything else at this point. So people should not forget that we have to have that testing, and also take the appropriate precaution. We say personal protection, washing hands, coughing with the right etiquettes, like covering your mouth and nose, and protect yourself. Stay home if you're sick, and do not go to work. Talk to your employer. And hand washing is so important.
Right.
Simple things, hand washing, proper hand washing is so crucial, and keep a sanitizer with you, hand sanitizer, in case if you don't have access anywhere where you're traveling.
Right,
so,
and try to resist touching your
right.
face with
Yes.
your hands,
Yes.
which may come in contact
because
with
coughing,
somebody.
sneezing
Sure.
put the droplets out, and those things can be put in the surfaces, and next thing you're touching, and then you're touching nose and eyes, and next thing you self-contaminated.
Let's talk about this. Dr. Gupta brought along a face mask. A lot of people are going out and buying these and saying, well, I can just wear this and I'll be fine.
Right.
And
No.
you want to set the record straight.
Right. So according to CDC, according to multiple studies, this face mask is not going to prevent people to get any virus, including coronavirus. What it does, if you are sick, you cover yourself so that you can protect others.
Right.
Because you're coughing, sneezing, you're not going to throw everything out in front of everybody else.
That's so important to distinguish there.
It
that
is
it's for
so
somebody
crucial.
who is sick,
Right.
you can wear that, but it's
Right.
not going to protect you from
Exactly.
getting sick.
Yeah. So that is so crucial, because people are going and buying and it's flying off the shelves.
Yes.
That's not the right way to do that, and there's no study which proven, and it's not even recommended. So what we are asking that do simple thing measures which we do it in flu at the time of flu, because There is no vaccine at this point. There's no typical treatment for this. What people can do, there's a lot of power in people's hand to protect themselves. And hand washing, staying home, and communicating with the doctor. And when the doctor, if depending on, you asked that question, that how do you think that should be tested? So the provider contacts us based on their conversation with the patient, and then we go through the whole scenario with them and identify if this could be a patient of interest, that patient under investigation we call it, and we will communicate with the New York State Department of Health and initiate the testing for this individual. That's how the process is, and now, as you mentioned, that it will happen in New York State Department of Health Wadsworth Lab, which we are really thrilled to have that at least proximity in the Albany. That will make life a lot easier for everybody.